In this video, we will discuss regarding some of the obstetrics and gynecology subject multiple choice questions. So the first question is station O. Okay, 0. Okay, station 0 is indicative of the presenting part. Option A, slightly above the ischial spine. Option B, at the level of ischial spine, slightly below the ischial spine, on the perineum. So here you can see the picture, that is fetal station. So the baby is head is near to the at the level of ischial spine, means that is 0. Okay, so the right answer is at the level of ischial spine. Option B is the right answer. For example, if they ask question that is plus minus 3, so minus 3 is, it is nothing but it is at the pubic. Okay, so here you can see the minus 3 at the level of pubic bone, and plus 2 just above the ischial spine. Minus 2 is above the ischial spine, minus 1 is a slightly above the ischial spine. So when you get the plus 1, plus 2 or plus 3 means it is below the ischial spine. So 0 is the at the level of ischial spine. So fetal station is nothing but where the fetus head is reached into the pelvis. Okay, so the right answer is option B. So the next question is partograph is also known as. So partograph ki inkoka name enti? Option A cervicograph, option B uterograph, option C ovariograph, option D vaginograph. సో ద రైట్ వన్ ఈస్ ఆప్షన్ ఏ సర్వైకోగ్రాఫ్. అంటే పార్టోగ్రాఫ్కి ఇంకొక నేమ్ ఏంటి? సర్వైకోగ్రాఫ్. సో ద రైట్ ఆన్సర్ ఈస్ ఆప్షన్ ఏ. సో నెక్స్ట్ క్వశ్చన్, హూ ఈజ్ ద పర్సన్ ఫస్ట్లీ యూజ్డ్ పార్టోగ్రాఫ్? సో మన అంటే పూర్వకాలంలో అంటే పాస్ట్ డేస్. సో హూ హ్యాస్ యూజ్డ్ దిస్ పార్టోగ్రాఫ్ సైంటిఫికలీ? ఆప్షన్ ఏ ఫ్రెడ్మ్యాన్, ఆప్షన్ బి ఏఐ ముదిలియార్, ఆప్షన్ సి విలియం షో, ఆప్షన్ డి షిరోడ్కర్. సో ద రైట్ పర్సన్ ఈజ్ ద ఆప్షన్ ఏ ఫ్రైడ్మ్యాన్. సో హీ ఈస్ ద పర్సన్, హీ ఈస్ యూజ్డ్ ద పార్టోగ్రాఫ్. The next one is drugs and x-rays should be avoided in the first trimester, second trimester, third trimester, fourth trimester. So is there any fourth trimester? No. So what is the first one? Option A, first trimester. Why? Because most of the body parts are formed in the first 3 months. So strictly drugs and x-rays are restricted in the first trimester of gestation. So the next one is forceps delivery may risk for. So what is actual forceps delivery? So when the baby is stuck in the pelvis, the forceps will be looks like this. Okay, so they will hold the baby head and they will ఆ బేబీ తలని పట్టుకొని బయటికి తీసుకురావడానికి యూజ్ చేసే ఇన్స్ట్రుమెంటే ఫోర్సెప్స్ డెలివరీ. సో ఈ ఫోర్సెప్స్ డెలివరీ అయినప్పుడు పిల్లల్లో జరిగే ప్రమాదాలు ఏంటి? సో వాట్ ఆర్ ద కామన్ రిస్క్ ఫర్ ద బేబీస్? ఆప్షన్ ఏ మైనర్ ఫేషియల్ ఇంజురీస్, ఆప్షన్ బి సెఫాలోహెమటోమా, ఆప్షన్ సి రెటినాల్ హెమరేజ్, ఆప్షన్ డి ఇంట్రాక్రేనియల్ హెమరేజ్. So the right one is option A. Facial injuries are more common in the forceps delivery, but cephalohematoma and intracranial hemorrhage can cause for the vacuum delivery. Okay. The next one is failure of uterus to return its normal size. So after the delivery of the baby, the uterus has to come back to the normal structure. Okay, so what is that meaning? So that is failure. So option A, involution, option B, subinvolution, option C, protrusion, option D, retraction. The right one is subinvolution. Subinvolution is nothing but the failure of uterus into the return into the normal structure. It is means that subinvolution. So involution is nothing but it is normal. Okay, return into the normal size, that is involution. Subinvolution is the failure of uterus to normal position, structure or size. The next one is which among the following is the correct regarding ectopic pregnancy? Option A, risk for subsequent ectopic pregnancy or more. Option B, infertility. Option C, high risk for sexually transmitted diseases. Option D, IUD, intrauterine devices contraindicated. So which one is the correct regarding about the ectopic pregnancy? So the right one is option A, risk for subsequent ectopic pregnancy in the future also. The next question is a mother that is 8 years old, weeks of gestation, given birth to the male baby, and the mother BP blood pressure is decreasing to 90 to 60 and pulse is 95 beats and uncontrolled bleeding from the birth canal. So what is this condition? Option A, remaining placental fragments in the uterus. Option B, postpartum hemorrhage. Option C, forceps delivery. Option D, gestational diabetes. So the right one is option B, postpartum hemorrhage. So when the mother is having postpartum hemorrhage, when the bleeding quantity of the amount of the blood that is above the 500 ml, so it is known as the postpartum hemorrhage. So in this condition the mother baby will be decreased and the pulse will be increased, so we can observe the bleeding from the birth canal. The next one is what is uterine polarity? So what is uterine polarity? Option A, the neuromuscular coordination lost. Option B, the neuromuscular harmony between two segments of the uterus throughout the labor. Option C, neurojunction lost with the whole uterus. Option D, none of the above. So what is uterine polarity? So the right option is option B, neuromuscular harmony. So it is nothing but neuron and muscle. So these both cells are coordinated and function properly during the complete labor complete labor process. So that is known as the uterine polarity. The next question is pregnancy mask is. So what is the meaning of pregnancy mask? Option A, Colasma gravidarium. Option B, melasma. Option C, hyperemesis gravidarium. Option D, both A and B. So the right one is option D, both A and B. So Colasma gravidarium, otherwise melasma. So these are the two names for the pregnancy mask. So next question, lightning occurs. Okay, lightning occurs during the. So in which age of gestation the lightning can be felt by the mother? Option A 34 weeks, option B 38 weeks, option C 30 weeks, option D 28 weeks. So the right one is option B, 38 weeks of gestation. The mother can feel the lightning. Okay, lightning is nothing but the baby head is reached to the ischial spine or the pubic bone. Okay, so it is ready for the delivery. The fetal head will be settle into the pelvis, that is lightening. The next one is transfer of antibodies from mother milk to baby is the immunity of what type of immunity the mother breastfeeding will give to the baby. Option A, natural active immunity. Option B, natural passive immunity. Option C, artificial active immunity. Option D, artificial passive immunity. So which one is the right answer? Put in the comment section. Okay, this is end of my class. Thank you for watching. Don't forget to like and share.